Hey Anna, thanks for being willing to do a video testimonial with us today. You've completed a program here over the last like 6 months or so. And what were some of your main presenting complaints that the three top that were driving you here?
Three top hive outbreaks was probably, I think, number one, along with...
So you had hives, and were they disseminated over the body, or were they in a focal area?
All over. Yeah.
How, like a scale of 1 to 10, tell us how bad your hives were.
A 10.
They were a 10.
Yes.
And how long had that been going on for?
Oh gosh, several months before I came.
Okay. And you had done some things on your own, a parasite kill and some other things, and gotten some improvements, but it was...
Still happening.
Still bad. Okay. So, what was your second worst complaint?
Just issues with my digestion.
Digestion problems.
Yeah.
And your third?
Acne.
So you were breaking out. It was especially bad around your cycle. And okay, so we did a lot of testing on you to get to the root causes. And we did some questionnaires, and do you feel like we worked really good at getting the root causes?
Yes, absolutely.
Okay, so we've addressed those root causes. We've gone through several rounds of products to eliminate these things. We changed your diet. What did you think about following a food antigen panel?
I think it was really helpful because there was a lot of foods that I was eating that I didn't realize were causing...
Tell me a few of those that are healthy foods that you would think were healthy foods, but that were actually inflammatory to you.
Asparagus is one that, I loved asparagus, and I would eat it constantly. Almonds were another thing.
Yeah.
Gosh, I can't think of anything else.
No, that's good. That's helpful. And that's what we find, carrots or blueberries in patients, spinach. And so it's surprising when we do a food antigen panel, and if the guts become leaky, how different foods that would normally be healthy are actually triggering an inflammatory response. So we did that. We've done a lot of work on the liver and the gastrointestinal tract. How's the GI tract feeling now?
Feels good. Yeah, I don't feel bloated anymore. Gas isn't an issue anymore. Normal stool movements. So
good. And we did a GI panel on you. It gave us some information, but in this particular case, rare. It really didn't illuminate the problem with candida that was actually became quite apparent after a questionnaire and after some more clinical finds. And so now that we've gone through all our protocols, the hives, how bad are the hives? What percentage of reduction do we have in the hives now?
Probably 90% reduction.
Okay, and we've just finished our last protocol, which will kind of bring things back a little bit. So I suspect that within a few weeks of allowing the body to calm back down, that'll be completely gone. And then you were complaining of some symptoms around your cycle, PMS type things, irritability. How has that gone?
I think like 90% improvement. I don't feel irritability. Cramping is almost completely gone. Cycles are normal and stable, kind of. A normal cycle, it's not 30 days 1 month, 25 the next. Lighter periods, so all good.
Awesome. And there was some psoriasis, and is that gone?
It is gone, yes.
And you had some sinus congestion, nasal problem, like allergy issues.
All gone.
Nice. There's a lot of skin itching, and that's gone. Frequency of urination and extreme thirst.
It's all better too.
So we had some blood sugar dysregulation going on and adrenal dysfunction. And you had a lot of stress, and I think you're coping with that better now.
Absolutely, yeah.
There was some low back pain that was radiating to the foot.
I think just with the reduction in inflammation, that's kind of gone away.
Good. Did we do some stretching with you?
We did.
And some back work? Okay. Well, awesome. You've been incredibly diligent, and so that's added to the great response. So great partner to work with, and we appreciate your compliance and your good work here, and it's great to see that you're doing so well. Thanks for your help on this video.
Thank you.